Hi, I'm Ajay Swaminathan. I'm a consultant gynecologist. This is more like an FAQ for a very common condition called premenstrual syndrome, or PMS. So what is actually PMS? It is a name that is given to the physical and emotional symptoms which can affect a woman during the 2 weeks just prior to her periods. Obviously, the symptoms either disappears or they go down by the end of your period. Okay. Now, is it common? Is it rare? It can affect anybody, any woman during their childbearing years. Around 30% of women can experience the symptoms in either the moderate to severe variety. So roughly 3 in 100 would have the symptoms. In addition to the woman or women who suffer, it also has a massive impact on both their families, their friends, work colleagues, so life in general can be affected. Now, there is a very severe form of PMS, which is called premenstrual dysphoric disorder, and that has got very strict criteria, so we won't be dealing with that in effect. Do we know what is the reason or what causes PMS? Obviously, we don't know the exact reason, but we do know that some women are more sensitive to hormonal changes during their cycle. There is also a potential basis for us to assume that it could be due to some chemical substance in the bloodstream called neurotransmitters. Now, before we go on to treatment, we have to diagnose it. So how do we diagnose PMS? Almost all women will have some form of PMS symptoms. It can move from changes in mood to feeling depressed. It can manifest as being irritable, being bad-tempered, being anxious, some physical symptoms like headaches or even changes to skin and hair, and sometimes feeling bloated. One of the easiest ways for us to come to terms with the exact diagnosis is actually to keep a diary. So you should keep a diary for at least 2 cycles. Put down everything in the diary, every symptom that you have, and also when your periods come as well. When you see a GP or your gynecologist, if you bring the diary, that would be very useful. Sometimes it can get a bit tricky and we might not be able to have a proper diagnosis even with the diary, in which case we could try a treatment called GnRH analogs, which can help us point in the right direction. The key thing is there is no specific blood test that we can use in diagnosing PMS. Now, the most important question here is, how do we treat women and their families suffering from PMS? As with anything, changes in your lifestyle, more exercise, a healthier diet, meditation, mindfulness, yoga, all of these can help you in terms of general life in itself. If you look at the medical treatment, doctors normally divide them into 2 groups. One is what we call the hormonal treatments, which involves the use of hormones, and the other one is non-hormonal treatments. These non-hormonal treatments include 2 very specific groups of antidepressants. They can either be started by the GP or by a healthcare professional other than a GP. So you could take it daily all the way through the cycle, or usually you take it for 2 weeks just before your period. Now, what are the side effects of it? Some women do suffer from side effects of these meds, which include nausea, some difficulty in sleeping, as well as some decreased libido. There is a very specific water tablet which can sometimes be used to control the physical symptoms of PMS. Now, coming to the hormonal treatment, which is what we as gynecologists we would tend to use more, there is a newer type of continuous combined pill which contains a hormone called drospirenol. So this is what we normally would recommend for helping with PMS, and we normally would give it as a continuous fashion without a break at all. In some women, we do use estrogen hormone, either as a patch or as a gel, to control the symptoms of PMS. The key thing to remember here is these patches or gels do not work as a contraceptive. Now, what if these don't work? Or what if these are not suitable in your case? So it is this time in which we use an injection called GnRH analogs. It is also used when we have a question about the diagnosis of PMS. So what does this do? It actually causes a temporary and reversible menopause. So what that means is eggs are not released and there are no periods. So if the symptoms get cured or get corrected by this, then we can to some extent say the symptoms are due to PMS. Obviously, this will have its own drawbacks or side effects. One of the key things we tend to worry about as doctors is the impact it can have on your bone strength.